Hello. I hope you had a wonderful summer. I know that we have all enjoyed our Labor Day, and now it's back to school and the fall activities are already starting. One of the first activities that we have is Hispanic Heritage Month, beginning the 15th of September, going through October 15th. This is the opportunity to really acknowledge those that have come from other countries and all of the special things that they have brought with them. I know we all enjoy the rich diversity we have in this community, and really taking time to learn about where people came from and their stories really give us the opportunity to understand just the fabric of the community we live in. So certainly we recognize Hispanic Heritage Month, and we look forward to the many festivals that will be around. I also am thrilled this week to acknowledge the recognition of SJ Magazine of our top docs. 31 of our physicians who are listed on the screen have been acknowledged for their great work with their patients, for their outstanding clinical care, as well as just the experience that they offer. So thank you, SJ Magazine, for taking the time to recognize our great docs, and of course, thank you to our physicians for their commitment to the community. I also want to mention to you that we acknowledged International Overdose Awareness Day, which was August 31st. At our Mulligan Hill campus, we had 80 purple flags on the lawn and the campus, representing all those who died in our community between August 22 and August 23. It is hard to really understand the breadth and depth of those losses for the family, and just the pain that we all understand that people are going through, which really generates this substance use disorder. And our community health needs assessment, right under behavioral health, mental health needs, was the need to be able to support substance use disorder. Often those mental health and behavioral health needs really manifest themselves because they go unattended to through the substance use disorder behaviors. And so we've really tried to make sure that we've expanded all of our service in behavioral health, whether it's our inpatient unit or our outpatient unit, really making sure that we can connect people to those important services and really identify one of the critical areas that we continue to face as a society. The loss of one life is too many. Certainly, as we looked at those 80 flags, it was just a reminder that we have a lot more work to do. When I speak about commitment to community, I love to tell you patient stories because it really goes to the heart of who we are and what we are. So this week's story is about a very special little boy, Carson Hudson. See, Carson has autism and also epilepsy, and his epileptic seizures can cause great stress, and at times that his family has to call for assistance in those situations when those seizures don't subside fast enough. And it just so happens that two of those individuals, Brittany Conrad and Brian Cassidy, have been on the scene and actually developed a very close relationship to Carson. He actually refers to them as his EMT buddies. And we actually worked with the family to make sure that we could share Carson's condition with other EMTs. So if they get called to the house, then we'll be able to make sure everybody knows how to appropriately support him to both get him through the epileptic seizure, but also to identify the specific issues of how we work with children with autism. It really has been a great benefit, and that benefit came to pass in May when the family found themselves with Carson suffering a 32-minute seizure. Sure enough, the paramedic team had already been briefed and they knew how to respond. And so we were able to quickly get Carson both to manage the seizure as well as to get him the care he needed. He ended up spending 5 days in the hospital, but when he got out, he went back to school and he told his teachers that his EMT angels were there to save him and help him through. We feel very deeply about making sure that clinical care is excellent that we deliver, but it's also about how we deliver it. And that really is about why Inspira is so special and why I'm so proud that we get to partner with you and walk on your healthcare journey with you. And for those of you who are celebrating at the end of the month, I want to make sure I wish you a very happy Rosh Hashanah and a meaningful Yom Kippur. Until we meet again, be well and stay safe.